Hi, I'm Terrence Bird. At Health First New Jersey, we believe everyone should be informed about the important healthcare issues that affect them and their families. That's why Health First is proud to support programming produced by the Caucus Educational Corporation.
The Affordable Care Act and what it means to you, next on Caucus New Jersey.
Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community. Health First New Jersey. QualCare, Inc., a local managed care company covering 750,000 New Jersey residents. And by Johnson & Johnson.
Welcome to Caucus, New Jersey. I'm Steve Adubato. As all of you know, on June 28, 2012, the United States Supreme Court upheld the Affordable Care Act. Here in the studio to discuss what this means to every New Jerseyan, we have Senator Joseph Vitale, chairman of the New Jersey State Senate Health Committee. The full name we'll go into later, Senator. Patricia Barnett, Chief Executive Officer, New Jersey State Nurses Association. Dr. Fred Jacobs, former Commissioner, New Jersey State Department of Health and Senior Services. And finally, Dr. Stephen Crystal, Board of Governors, Professor, Rutgers University. Senator, the full title of your committee is?
Senate Health, Human Services, and Senior Citizens.
Commissioner, former Commissioner, is that correct?
That's correct.
Just want to clarify that. Just want to see if we have agreement. Okay, Senator, help us out here. You're the leader in the legislature on this issue. When the Supreme Court made that decision, I know that you said publicly you were pleasantly surprised and pleased.
Yes, very pleased, yeah.
The key elements, because one of the things we'll talk about is the fact that so few New Jerseyans and Americans really understand what is in the Affordable Care Act. The key elements of the act as it is implemented or will be implemented in 2014 or not, depending upon what happens in the fall of 2012. The key elements are?
Well, upwards of 30 million Americans will have access to health insurance where they previously could not afford it. In New Jersey, over 1 million New Jerseyans who don't presently have health insurance, either their employer or individually will have access to affordable health insurance mostly through subsidies. The way the products will be designed will have 5 or 6 design elements that people can choose from. There'll be a bronze, a silver, a gold, a platinum plan. But all those plans will have, at the very base, necessary health care services, whether it's preventive care, hospitalization, all the care that those of us who have health insurance are accustomed to having and access to.
Will private insurance be dead after this?
No, not at all. In fact, private insurance is going to have upwards of 30 more million customers.
Pat, what will it mean to nurses? Because we'll talk about what it means to patients, what it means to doctors, what it means to hospitals, what it means to health insurance providers, health insurance companies, drug companies. But what does it mean to nurses? Because I know there's specific aspects of the Affordable Care Act that talks very clearly about nurses, nursing education. Go ahead.
It does provide for additional education for nurses. They want to expand the number of advanced practice nurses who can provide. Current advanced practice nurses are nurses who can, basically, they are the primary care provider for a patient, or they may be like the nurse who delivers the baby. They are nurses who are prepared with advanced degrees to be able to help patients. They can write prescriptions, they can treat patients, they can order tests. They are their primary care provider, or in terms of nurses who work with mothers and babies, midwives.
Dr. Jacobs, I said before that many of the aspects of this law to be implemented in 2014, unless, in fact, there is a new president, President Romney, and he has said one of his, actually the first thing he would attempt to do would be to change the law, but there is Congress, and we'll see what would happen then. And we'll talk about what that potentially would mean. Why do you think so many New Jerseyans and Americans are so unsure as to what this law does and is?
You know, I think just recently President Obama was on an interview where they asked him what was the thing you have as your greatest regret during the first 3 years of your term, and he said, you know, I spent so much time getting the policy right that I didn't emphasize enough the communication. And I think people in the United States today who are confused about this are because the administration didn't do a good job in communication.
Well, how do you not know that? I mean, again, a Capitol Report is our political show where we discuss public policy. This is a different format and a different mandate for caucus, but it's very simple. How do you not know that when you're talking about a sweeping change like this, that one of the first roles of a leader is to communicate clearly and help people understand? Oh, geez, I forgot to do that.
Well, if I was president of the United States, I wouldn't have made that mistake, but I don't know.
Clearly.
Yeah, but I don't know what.
And it got actually more confusing as the president spoke early on.
It did.
And it's not, I don't know if it's any less confusing now.
You know, it's not only confusing for the average rank and file American, it's confusing for the doctors as well. For instance, you talk to doctors now and say, there's going to be a large number of increased people who are now covered on Medicaid.
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 It increases the number of people under Medicaid.
Right.
Go ahead.
And they say, but Medicaid pays so little that I don't take Medicaid. And then I say to them, but if you're a primary care doctor, internist, general practitioner, family doctor, or pediatrician, they're going to pay you at 100% of Medicare.
What?
100% of Medicare.
I thought you said Medicaid.
That's right. The Medicaid, the newly enrolled Medicaid patients will be covered for 100% of Medicare rates in the primary care field.
So it's good for doctors.
It's great for doctors.
But many doctors are walking around thinking it's bad for them.
Right, because they are confused, misinformed, or they have a political agenda, or whatever it is. But the fact is that that's what happens. If you're in primary care, you get 100% coverage, 100% of that. And the states, by the way, of all these newly enrolled people, 100% of their costs are paid for by the feds. It only goes down to 90%. So the minimum is 90%. So when people, when I was in office, the big mantra was, don't leave federal money on the table. Well, here, they're leaving this huge amount of federal money on the table by even talking about not implementing these exchanges and things. It's crazy.
I'll come back to you, Senator. Dr. Crystal, you have said, and I mentioned it a couple of times, if this law is repealed, it would be a disaster.
It'll be a disaster.
Make the case.
It'll be a free-for-all, and we need to channel the forces of competition into a structured system. So basically what you have, you have so many special interests out there, and people sort of, the pure model of the patient as the consumer, and the patient will make rational decisions based on price. Patients don't have enough information to do that. The basic problem, I see the Affordable Care Act as just the beginning. It sets a framework. What we now need to do is re-engineer the whole system of clinical delivery in a way that's more rational. So
break that down. So a little bit jargony, respectfully, Doctor.
Right.
Re-engineer this. Break that down in simple English.
You need to use information technology in a much more effective way. You need to. We have tremendous amounts of wasted resources that we can't afford in this country because tests get repeated, communications are poor between primary care doctors and specialists and other practitioners like
nurse practitioners. So how does the Affordable Care Act change that?
It starts to put some structure to the system that we can build on. I see that as the most important thing. Beyond that, we can't afford to have so many uninsured people anymore. It is just it's a huge load on the hospitals. It's a huge load on society, and so it's really important that we're the only country, the only developed country that has these huge numbers of uninsured people, and we have people who are one sickness away from becoming uninsurable. And those are the people that really have a stake. They really have a dog in this fight, because if you lose your position, you become the Affordable Care Act makes it possible to mandate insurance companies to take all comers at fixed rate, at what's called community rating. That's only possible because of all the other elements, including the requirement to buy in.
Okay, but here's the thing: there's a requirement, and Senator, we talked about the impact that the Affordable Care Act would have on lots of different New Jerseyans. Mm-hmm. There are New Jerseyans who are also small business people. And this program would not be responsible if we did not raise the following question. Is it a fact that in the Affordable Care Act, that if you have a business of 50 people or more, that you are required to provide health insurance for those people? And if you do not, that you are paying, I don't care whether we call it a penalty or tax, I'm not going to play that game. You pay for every person that you do not provide insurance for, correct?
That's correct. However, if you don't cover them, and they opt out of coverage at the employer level, they can go into the exchange, and the employer can...
You just used the word that you're talking about explain the exchange, because I don't want to assume everyone knows what that means.
Well, the exchange is going to be a place where a clearinghouse of insurance information and access to individuals through online or through community groups that can sign them up. So it'll be an opportunity for the state to clearly put forth an exchange, meaning a place in which people can go online and decide between 4 or 5 really good, well-designed HMOs with different levels of coverage that they can, from which they can choose, and also understand what their cost implications would be and what the subsidy would be. So the lower income you are, some of these individuals would be covered at 100% subsidy, and as their income goes up, then the subsidy would go down, but they would be fully subsidized at some point. Some would be partially subsidized. Small businesses would receive a tax credit for the insurance they provide for their employees. There's always one concern that employers would rather eat the penalty.
Yes, I've heard that.
And it's called crowd out. And
crowd out.
Crowd out, meaning crowd out their employees into the exchange. They'll say to them, instead of me having to pay $2,000 for family coverage or individual coverage for you every year, I'll give you $1,000, go into the exchange, I'll eat the penalty, which is less than I would have paid, and you can go into the exchange. I don't believe, in all the studies I've done over the years, that most responsible employers who offer health insurance as a primary benefit pardon me, would allow their employees to just leave and go into the exchange, because health insurance is beyond, and in some cases more than their salary, is the most important thing for them.
But Senator, I also know some business people, anecdotally, not based on peer-reviewed, scientific research, but I know some employees that were in that 50 range, employers who have said, I'm seriously thinking of letting some employees go to get under the level of 50 employees so that I am not required to provide it. That is not a good thing. If that is going to happen, that's not a good thing for those people who lose those jobs. It's not a good thing for the economy. What do we say to those folks?
Well, I think that some of that is rhetoric. I mean, it's just like people saying that.
It's not rhetoric to someone who loses their job.
No, it's a rhetoric for the employee who says that.
Okay.
Because if they have 50 employees right now, and in this economy, there's not a lot of fat in your business. So are you going to lose, are you going to let go 5, 10, 4, 3 employees who provide an important service to your company so that you can get under the requirement? I don't think that'll happen. In most cases.
You don't buy it?
No, I don't buy it. I think it's rhetoric. It's the same people, same thing that doctors say or others say, that we're going to leave New Jersey and go to Delaware or Pennsylvania or somewhere else because the taxes are lower. The cost of moving your business and doing all that is just too much for them, and it's all rhetoric.
Okay. Again, we want to make sure we have the most candid, substantive conversation. By the way, Governor Christie had said some very clear things about this. He has said he's not anxious to move on these exchanges. He has said let the federal government lead the exchange effort.
Maybe.
Maybe.
Yes, he said maybe.
We'll see.
He said maybe. His veto message when the legislature took him a bill to create the exchanges is very interesting, because he essentially said, well, we need to wait to see what the Supreme Court does. But if
then the Supreme Court acted.
And if but he said in his veto message that if the Supreme Court upheld the law, it was his intent to proceed with implementation.
Right, and now he's moved the goalpost. So he said
Right.
that we're going to wait until we did the bill. Senator Gill and I sponsored the bill. It moved to the legislature, gets to the governor's desk. He vetoes the bill because he doesn't like elements of it. Then he says it's premature because the Supreme Court hasn't acted. I'm going to wait until that happens. Supreme Court acts. Now he says, well, I'm going to wait until November, till the elections are over. So now he's moved the goalpost to then.
Right.
So if it is that President Obama is reelected, now what's the excuse going to be?
Well, we'll see what happens when and if that happens.
Yeah.
Whether there's a President Obama or President Romney. I'll bring you back in, Doctor, but let me ask you this. On the issue of prevention, Pat, what specifically does the Affordable Care Act do and say? And by the way, I want to be clear. If implemented, we are not talking about 2013. We are talking about January of 2014. Now, again, lots of things happened between now and then. The implementation is January 2014. What does the Affordable Care Act say about prevention?
It's a huge bonus in that bill.
Bonus?
It's a bonus because currently there are many people who don't have access to mammograms. There are people that don't have access to your basic primary care screenings. Are you diabetic or not? Let's check your eyes. You've got kids that may not have wellness visits to see are they progressing as they should. When you look at some of the serious problems we have in healthcare, we treat the end. We spend more money in New Jersey than any other state on your end of life. The last few months you lived, last year.
Yeah, we do.
We don't spend much at all on the front. If you've got someone who's a little bit overweight, maybe a little hypertensive, maybe borderline diabetic, If you can treat them then, have them lose weight, help them manage their diabetes or their pre-diabetic state, help them get their hypertension under control, the cost of that person's health care throughout their life to the state as well as to society is much lower.
But what does the Affordable Care Act do with respect to those people?
It covers all the basic prevention and screening.
It covers it?
It covers it.
Doctor, you agree?
Well, it covers it in some ways. See, here's the problem. The problem is, where are you going to get the health care manpower, the doctors, the primary care,
power, right.
the people
to do You've
this.
said to our producers, you've told me in past interviews, we do not have enough physicians and clinicians to respond to the demand. Go ahead.
That's absolutely right. And now that the Affordable Care Act has been upheld, the Association of American Medical Colleges, which is the organization, the umbrella organization for all the American medical schools in the United States and Canada, has a workforce group. And the workforce group predicts that if the Affordable Care Act is upheld, which it was by the year 2020, which is 7 years from now, there will be a shortfall of 90,000 doctors in the United States. The way you get to that number is by looking at the demographics of the medical care supply now. There's a lot of women in the force who are doing everything. I have a daughter who does that. I mean, she's a mother, she's a doctor, she's a wife, she does all this stuff. There are people retiring early, and the baby boomers are coming through, increasing demand for care. On top of that is now all these newly covered people who are now also going to demand,
based on the Affordable Care Act,
based on the Affordable Care Act, regular comprehensive continuum of care work. And yet the number of residency positions in the United States has not increased more than 1% over 10 years. And that is funded largely by Medicare. Medicare pays for graduate medical education, and it's not been possible for the Congress to get a bill through that would increase the number of residencies. Unless they do that, we're not going to have the medical manpower. Now, some things
Meaning, I want to explain it clear, that on paper, it's going to look like a plan that you think makes sense, but if you don't have the people to implement it and execute it,
you'll confuse coverage with care. Just because people are covered doesn't mean they get the care. Now, let me tell you what the Affordable Care Act does do. It does increase residencies a little bit. It takes the unused residency positions from hospitals that are closed and redistributes them. It takes ambulatory care centers, including federally qualified health centers, and ensures that they'll have primary care residencies, not there now. So that's a step in the right direction, and we're very supportive of that. But it doesn't go far enough in a traditional
Senator
way.
and Steve, go ahead. All the way around. We've got about 8 minutes left. Go ahead, Senator.
I think what we're going to do is we're going to have, I think Dr. Jacob is right, we do have this shortage. We've had it for quite some time, but the legislature has been acting over this past several years to provide loan redemption programs and grants to incentivize young people to go into primary care. That also includes nurse practitioners who are very key to the primary care system in the state.
Playing catch up, Senator.
We are playing catch up, but if we don't, we've been playing catch up for a long time in the absence of the Affordable Care Act. Now's, I think, lights a fire under a lot of people to get this done. You can't graduate a doctor within just a few years. It's a long process, but we have to start somewhere. So, you know, I think New Jersey does best, or most governments do best, when there's a gun to their head, and they've got to get this thing done. The gun's to our head.
Pretty big gun.
Yeah, it is.
Well,
Steve and then Pat.
So supply of physicians is one element, but only one element. We need to find, this is what I was talking about before, that when you're dealing so much with chronic disease, you need to find ways to have functioning healthcare teams. And that's where the other levels of practitioners who are underutilized come in. Pat will probably talk more about that. Beyond that, there's, we were talking about this before, there's the issue of the flight from primary care. So we have an awful lot of people trained in internal medicine, for example, who are running away from primary care. Because they could get paid better. Because
they're not getting paid enough.
Because we have an imbalance in what we pay. You pay somebody more for a 5-minute procedure than you pay for an hour of sort of carefully working up their
Look, there's a lot of people who want to do primary care. There are a lot of people. They're underfunded and disincentivized because of the payment scale, no question. But the biggest reason you don't get people into primary care is because there aren't enough primary care residencies, and they're not funded as well.
And does the Affordable Care Act address that specifically?
Yes, it begins. It's not enough, but it begins. It does begin in the way I mentioned.
Patricia.
Well, I'm glad you touched on the advanced practice nurses. One of the issues in New Jersey, and Senator Vitale has been a great champion of this, is we need to remove the barriers to practice for all people who can do primary
Barriers
care.
to practice.
In New Jersey, advanced practice nurses must work under a joint protocol if they write prescriptions. What does that mean? That the doctor doesn't say, "Mother, may I," and they have to sign off on them, but they have to have a contract with the doctor. Once a year, they have to sign this. The doctor reviews a certain number of charts. It's become a barrier because some doctors will not sign an agreement. Some doctors are now charging APNs up to 10% of their profits to do this.
Advanced practice nurses.
For advanced
but
practice
why?
nurses.
But if there are not enough physicians, if there are not enough primary care physicians, if the Affordable Care Act can only do so much, and as the Senator said, it's a long process, graduate medical education, okay, we're talking about not going to snap our fingers, why would physicians stand in the way of that?
Well, I think part of it's generational. I think part of it that physicians don't feel that APNs can do the work. If you talk to a younger doctor, most of them are fine because they work with them, but many older doctors don't feel that APNs can work independently.
Does the Affordable Care Act address this at all? Does it facilitate this at all?
It does, in that it does support nurse-run clinics. It does support advanced practice.
4 minutes left. What have we missed here?
It's a turf battle.
A turf over what? Where does it leave the patient, Senator?
Well, that's the problem. It's a turf over money. Every time I've introduced legislation, and we've been successful in extending the scope of practice for our nurse practitioners.
I mean, they can do more.
They can do more, meaning that they have more training, pharmacological training and all that, to be able to diagnose and prescribe for primary care only. And this isn't brain surgery. This is primary care. Then they have the ability and the credentials and licensing to do that. And many doctors, not all, particularly the medical society, who is a group of kind of akin them with the they're sort of the NRA of the doctor community. They're really hard, steadfast on preventing nurses from doing this kind of work.
Senator.
No, I know, I've sat with them, and they are vehement in their opposition to nurses being able to extend their scope of practice.
All right, got 3 minutes left. Anything else about the Affordable Care Act that means something in New Jersey? And give you 30 seconds around. Keep going. Steve, and I'll come back to you.
Critical issue is whether the state moves forward energetically with implementation. Implementation of exchanges.
They don't have a choice.
Implementation of the Medicaid expansion. Well, you can choose to drag your feet, as some states are doing. You can choose to let the feds do it, or we can take ownership and say, let's make this work.
Hold on, understand something. What does that mean about this Medicare expansion?
See, what I'd like to say in the 30 seconds we have is that a lot of this stuff has to do with wellness and prevention. So if you take things like has been mentioned, hypertension, smoking cessation, diabetes.
Big thing for you.
Oh, right. Morbid obesity, stuff like that, all of which, by the way, are outpatient, out of the hospital situations. There is no incentive for hospitals to get involved with this. They're not paid for taking care of people and making it so they don't have to be admitted to the hospital. Consequently, the Affordable Care Act, which doesn't address that, there needs to be a progression into the way hospitals are financed so that they have an incentive to reach out into the community, to justify their tax-exempt status, and to do what they are licensed to do in the public interest, take care of the population as a whole.
Got it. 2 minutes left. What else does the Affordable Care Act do that people need to know about? Pat and then Senator, go.
I think people need to realize it also will create a lot of jobs and deal with the fact that we've got...
What kind of jobs?
Healthcare providers. It could be a nurse's aide. It could be a community care worker, a case manager. It creates those kind of positions. And when you look at the hospitals right now with uncompensated care, there's $700 million a year.
Uncompensated care. People come into the emergency room. They do not have insurance. Someone has to pay for their care.
Their care. The Affordable Care Act will allow many of the patients that end up in the emergency rooms to be treated in a primary care setting, much less expensive. Those hospitals won't have to eat it. We've gone from 100 hospitals to 70 hospitals in the last 15 years. We have a number of hospitals in the state who are on the borderline of failure. And that uncompensated care is a big part of that.
Senator, what else does the act do that is important for people to know about?
What it has already done, look at Dr. Jeff Brennan, I'm sure, with whom you've had a conversation.
Down in Camden many times.
The accountable care organizations that they have formed and will form throughout the state.
ACOs, accountable care organizations.
Which give them the incentive to treat patients who are the frequent flyers, who don't have health insurance, to be able to manage them better, save money so they share in the cost and share in the profit. They give some of the profit back to the state, back to the feds, and they get to save some of that profit so they can reinvest in the system. These are people who cost the system tens of millions of dollars every year here just in this state.
Finally, 30 seconds. Steve Crystal, what's the role of the media, particularly those of us in public television, public media, in helping to educate the public in all this?
The issues are very complicated. They've been gamed by special interests all over the place. They've been turned into partisan politics to an unprecedented degree. So the role of the media is critical. It's really important for people to try to understand what the bill is and what it means for them.
I promise you the first of many, many conversations on the subject. Oh, as long as we bring in the dollars to do it. Okay.
The preceding program has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, Health First New Jersey, QualCare Inc., a local managed care company covering 750,000 New Jersey residents, and by Johnson & Johnson. Promotional support provided by NJ Biz, All Business, All New Jersey, The Star Ledger, and NJ.com, Everything Jersey, and by New Jersey Monthly, the magazine of the Garden State, available at newsstands. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios. Brought to you by the Healthcare Foundation of New Jersey.
If you're a small business owner, you can actually pool together with other small businesses, the same way large companies do, to help your employees make the best choice for their health care coverage. To learn more, information about health care options is available at the New Jersey Citizen Action Helpline, 1-888-654-3893.
Brought to you by the Healthcare Foundation of New Jersey.
This is One-on-One. Join me as we get up close and personal with some of today's most compelling personalities.
This is one you can't afford to miss.
Weeknights at 7 and 11:30 p.m. on NJTV and 12:30 a.m. on 13.